Hi, my name is Harvey Winkler, and I am the System Chief of Urogynecology at Northwell Health in New York. For me, when discussing treatment options and mid-urethral slings and mesh-based products for the treatment of stress urinary incontinence in women, it's really a process of developing relationship and a trust between me and the patient. That begins at the patient's first visit. I rarely schedule surgery when a patient first comes into the office. That patient is there on a fact-finding mission. She wants to find out more information about her symptoms. She wants to find out more information about her stress urinary incontinence, and she wants to hear her treatment options. I do not feel that anyone wants to be pushed or coerced into any type of treatment decision when they're just meeting you the first time. So at that first visit, we're discussing what stress urinary incontinence is. I am giving them their treatment options. Obviously, doing nothing is an option. They can do Kegel exercises, pelvic muscle exercises, with or without physical therapy or biofeedback. There are medications that we can use off-label. There are intravaginal devices, and then there are surgical options. I'll briefly discuss the surgical options with the patient at that first visit. We'll talk about mid-urethral slings. We'll talk about Birch procedures, which can be done through open abdominal incisions or laparoscopically that are slightly larger or more invasive type procedures. We'll touch on autologous slings as well as periurethral bulking. Those patients are going to get some patient information that they can take home, that they can read about stress urinary incontinence, and that they can think about what their treatment options. It is really important to me that a patient makes their own decision of how to proceed, whether or not they want to do surgical or non-surgical testing. Patients may come back for some type of objective testing to demonstrate their stress urinary incontinence. And then we'll once again sit down and have a discussion about the surgical treatment and or non-surgical treatment. When we talk about mid-urethral slings, I show them an example of a mid-urethral sling. We discussed that mid-urethral slings have been around for 20 years. They are the most studied anti-incontinence procedure that we know of to date. They have a proven track record. Patients are happy, and patients are able to recover and go back to work quickly or go back to their normal life. We do discuss alternative treatment options. Birch procedures, autologous slings, many of those are more invasive procedures and may have more complications. I want the patient to feel at ease that she is going for a mid-urethral sling. I want it to be her choice, and I want her to want that sling. She wants to be able to run, jump, get back to her normal day activities. And the mid-urethral sling is going to give her that greatest chance of cure as well as recovery and back to her normal day life. I have patients where we do the mid-urethral sling on a Thursday. Many of them are back to work by Monday and back to normal activity with exercise within 2 to 3 weeks after the surgical correction. I give them some information about a mid-urethral sling at that day as well. The OGS information on mid-urethral slings is excellent. I want the patient to have as much information that they can about the mid-urethral sling. I want them to want it, and I want them to be reassured that it's a safe procedure. I may tell them that I have friends, colleagues, other doctors that have had a mid-urethral sling. I see people every single day that I've treated with a mid-urethral sling and are doing well and happy with them. And I would be happy to help any patient if they wanted a mid-urethral sling for the treatment of stress urinary incontinence.